If my doctors don't agree, how do I make treatment decisions?
So one extra complication in multiple myeloma is that the doctors don't always agree. Even the myeloma experts don't always agree. There are different philosophies of treatment. Some favor less aggressive treatment, some favor more aggressive treatment, some favor just different types of therapies that are being used in the clinic. Some of it is the research that they've done and the experience that they have with those. So what we suggest is that patients potentially get second or third opinions even when they're trying to make treatment decisions. And as you get more educated on different ways of seeing treatment options, you'll be able to ask better questions. Sometimes, if they don't agree, sometimes it's a matter of going to these second or third opinions and then making a decision based on your personal needs. So sometimes somebody might want an all-oral therapy, and that might be really important because you live really far from the clinic and getting infusions are really tough. Or it might mean that you're younger and you want a more aggressive therapy because you want to shoot for a longer remission point. And so some of these are personal goals and just what you want out of your therapy too, in terms of your goals with having myeloma.
Myeloma specialists do not agree on treatment protocols. Unfortunately, myeloma is not an exact science. You can find specialists who say that transplant should be the first treatment for everyone who's eligible, and you can find equally good specialists who say that isn't necessarily the case. They're both specialists and they both know what they're doing. Initial therapy can be different between specialists. Treatment at relapse can certainly be different between specialists. We have so many treatment options now that the numbers are just exponential when it comes to treatment options. And definitely there's a different philosophy on treatment and putting treatments together. So specialists are not in all agreement when it comes to myeloma therapy. It's very difficult for patients to make a decision when doctors don't agree. The main thing that patients have to do is to educate themselves. You really have to know your disease. Go to support groups, talk to other people who have myeloma. You can get good information on websites such as the IMF, the MMRF, Myeloma Crowd, Myeloma Care. Leukemia Lymphoma Society has some good seminars. There are webinars, cure talks. The treatment really depends on you. If your doctors don't agree, you're the one who makes the final decision. You have to educate yourself.
You put 3 myeloma experts in a room and give them the same information on the patient, all 3 of which will provide you with a different treatment strategy. But I think the important thing is that these myeloma specialists are so skilled and so up to date on the newest and best treatments. And what I mean by that is that in the last 4 years, we've had 6 new drugs, which is phenomenal. And as a result, there's so many options available to them that that they can come up with a different strategy or a different treatment philosophy, all of which will result in improved survival. And what I mean by that is that, myeloma specialists often will give you something on the order of 10 to 12 years of average survival, where the normal SEER data shows only 5 or 6. So it's very, very important that it be a myeloma specialist and that they do all the right things that you want. And one of which is you've got to decide on your own, what are your objectives? What you'll find is that a myeloma specialist can provide you at least with a plan that provides you the best opportunity for improved life expectancy.